A client with a diagnosis of passive-aggressive personality disorder is seen at the local mental health clinic. A common characteristic of persons with passive-aggressive personality disorder is. The options are A. Superior intelligence, B. Underlying hostility, C. Dependence on others, D. Ability to share feelings. The answer is option B. Underlying hostility. The client with passive-aggressive personality disorder often has underlying hostility that is exhibited as acting out behavior. The client who has been receiving urokinase has a large bloody bowel movement. Which action would be best for the nurse to take immediately? The options are A. Administer vitamin KIM, B. Stop the urokinase, C. Reduce the urokinase and administer heparin, D. Stop the urokinase and call the doctor. The answer is option D. Stop the urokinase and call the doctor. Urokinase is a thrombolytic used to destroy a clot following a myocardial infarction. If the client exhibits overt signs of bleeding, the nurse should stop the medication, call the doctor immediately, and prepare the antidote, which is aminocaproic acid. The nurse is caring for a client with peripheral vascular disease. To correctly assess the oxygen saturation level, the monitor may be placed on thigh. The options are A. Hip, B. Ankle, C. Earlobe, D. Chin. The answer is option C. Earlobe. If the finger cannot be used, the next best place to apply the oxygen monitor is the earlobe. While caring for a client with hypertension, the nurse notes the following vital signs: BP of 140/20, pulse 120, respirations 36, temperature 100.8 degrees Fahrenheit. The nurse's initial action should be to. The options are A. Call the doctor, B. Recheck the vital signs, C. Obtain arterial blood gases, D. Obtain an ECG. The answer is option A. Call the doctor. The client is exhibiting a widened pulse pressure, tachycardia, and tachypnea. The next action after obtaining these vital signs is to notify the doctor for additional orders. The nurse is preparing a client with an axillopopliteal bypass graft for discharge. The client should be taught to avoid. The options are A. Using a recliner to rest, B. Resting in supine position, C. Sitting in a straight chair, D. Sleeping in right SIMS position. The answer is option C. Sitting in a straight chair. The client with a femoral popliteal bypass graft should avoid activities that can occlude the femoral artery graft, sitting in the straight chair and wearing tight clothes. The nurse is teaching the client regarding use of sodium warfarin. Which statement made by the client would require further teaching? Options are A. I will have blood drawn every month, B. I will assess my skin for a rash, C. I take aspirin for a headache, D. I will use an electric razor to shave. The answer is option C. I take aspirin for a headache. The client taking an anticoagulant should not take aspirin because it will further increase bleeding. In planning care for the patient with ulcerative colitis, the nurse identifies which nursing diagnosis is a priority. The options are A. Anxiety, B. Impaired skin integrity, C. Fluid volume deficit, D. Nutrition altered, less than body requirements. The answer is option C. Fluid volume deficit. Fluid volume deficit can lead to metabolic acidosis and electrolyte loss. The other nursing diagnoses in answers A, B, and D might be applicable but are of lesser priority. The patient is in labor room having fetal heart rates of 100 to 110 beats during the contractions. The first action the nurse should take is to. The options are A. Apply an internal monitor, B. Turn the client to left side and administer oxygen, C. Get the client up and walk her in the hall, D. Move the client to the operation room. The answer is option B. Turn the patient to left side and administer oxygen. The normal fetal heart rate is 120 to 160 bpm. A heart rate of 100 to 110 bpm is bradycardia. The first action would be to turn the client to the left side and administer oxygen. An adult is admitted to the hospital after several days of vomiting. Her breathing is now slow and shallow. What acid-base imbalance does the nurse suspect? The options are A. Respiratory acidosis with metabolic compensation, B. Respiratory alkalosis with little metabolic compensation, C. Metabolic alkalosis with respiratory compensation. D. Metabolic acidosis with little respiratory compensation. The answer is option C. Metabolic alkalosis with respiratory compensation. Patient who is vomiting is losing acid and will go into metabolic alkalosis. The slow, shallow breathing is evidence of trying to hold on to carbon dioxide, which is acid, thus compensating for the alkalosis. An elderly adult patient has a nasogastric tube and an intravenous line. The client is confused and attempts to remove both the nasogastric tube and the intravenous line. How should the nurse ensure the client's safety? The options are: A. Apply 4-point restraints. B. Ask the physician for an order for wrist restraints. C. Request a ward attendant to stay with the patient. D. Suggest that the family stay with the patient at all times. The answer is option B. Ask the physician for an order for wrist restraints. The patient is at risk for injuring himself, so restraints are indicated. The nurse should ask the physician for an order for wrist restraints.